ladies, no one wants to talk about it, much less live with it, but 1 in 4 adult women are struggling with something that can really make everyday life more stressful and embarrassing. We're talking about leaky bladders, but there's hope. And here to help, we want to welcome back our straight-talking OBGYN, Dr. Lisa, to Twin Cities Live. Dr. Lisa, it's so nice to see you.
It's a pleasure to be here.
You always make these kind of tough conversations easier and more fun so that all we can do is just get through the embarrassing stuff and then get things fixed and live a happier life. So let's talk about this leaky bladder. We're going to laugh about it, all right? So let's just get it out of the way. What are the troubles? What are we finding here, Dr. Lisa?
Well, the 2 major causes for leaky bladder would be stress incontinence and urge incontinence.
Okay.
But commonly, most patients have stress incontinence. So one of the biggest jokes is when I sneeze, I pee simultaneously.
I hate the fact that every time I sneeze, I pee my pants a little.
Absolutely.
Yeah, look at that, guys. Anybody, ladies, familiar with this? How about the next one? I laughed so hard, tears ran down my leg.
I love that one. That is so true.
And how about this one? How do I know I've hit middle age? In preparation for a big sneeze, I cross my legs really hard and hope for the best. I mean, seriously, when you start talking to your friends, women, or your sisters, or your moms, you are going to know that so many women are dealing with this issue. And it can be really kind of embarrassing.
It's very embarrassing. In fact, it's so embarrassing that most patients, most people don't even talk about it.
Yeah, they don't even want to talk about it.
Exactly. So they're embarrassed to even bring it up to their physician.
Mm-hmm.
And because commonly you only have either surgery or medication to treat it, most patients don't want either. So they'll just live with it.
So it happens to both men and women, but really commonly with women. I always hear people say too, after like 1 baby, you're fine. Have a few more and then you've got troubles.
Yes, well, I had 4 children, and I can only tell you after the 2nd or 3rd, it's all done with. So,
wow. So the stress one is most common in younger women, and this happens then stress incontinence. Your muscles are just a little bit weaker.
So stress incontinence can occur in both young as well as older. There's a loss of collagen, loss of support to the bladder neck, which leads to the leakage of urine when you cough or sneeze.
And then the difference between urge incontinence, what does that mean?
Urge just means you gotta pee. So the old commercial, gotta go, where there's just a really strong sense of urgency. And there'll be some women who have to go really frequently and others that just barely can make it to the bathroom in time.
So when you hear that 1 in 4 number, I mean, I think that's so shocking. On the one hand, it makes you think, boy, too many women are dealing with this. On the other hand, it makes you think you shouldn't be embarrassed to talk about it because you're certainly not the only one. Even your doctor might have dealt with it as well. So how do we fix it? That's the positive that you come here with. And Kegel exercises are something we've talked about a lot. So what do we do and how does it make a difference?
So again, Kegel exercises are exercising the muscles internally inside the pelvis. We've all heard about this, but commonly women don't know exactly where these muscles are located. So if I asked a group of women to do Kegel exercises, some are going to contract their buttocks, some will bear down, some will, do everything but actually contracting those muscles internally.
So you could be doing them a lot and not really doing any good.
That's correct. So unfortunately that can happen and probably does happen really frequently. So we have a device. It's actually a medical device that was developed by physical therapists. It is called the Apex Intensity. So it is a medical device that helps to identify specifically where these muscles are. So this is a pelvic floor strengthener in that it's placed inside, and there's contact plates on the upper and lower aspect that come in contact with the walls of the vagina. You then pump it up, and this can be activated to deliver a very low-grade electrical stimulus, similar to like a TENS unit, if you've ever heard of a TENS unit before.
Okay.
So TENS units are commonly used in therapy to strengthen muscles like in the neck, back, shoulders, etc. So this again isolates those internal pelvic muscles, causing them to contract, therefore strengthening them. What this does is going to improve your continence, both stress incontinence as well as urge incontinence. It can actually improve both.
Wow, so is this something that then you do always in a doctor's office, and how long does it take to make a difference?
This is actually a home device that can be utilized, and so that's the benefit of that. Again, a patient actually can go to a physical therapist to do exercises along with the physical therapist, but this is going to be a home therapy. This is a device that is only sold typically in a doctor's office, and most gynecologists should be able to carry this device.
And then tell me about the Mona Lisa touch, how that can make a difference.
So the Mona Lisa Touch is a revolutionary treatment that uses a laser to basically laser the circumference of the vagina. And what's commonly not known is that the bladder actually lives essentially in the vagina. So when we look at anatomy pictures, it seems like the bladder's here and the other pelvic structures, well, not true at all. They're just microns away from each other. So if the tissue within the vagina is becoming unhealthy, if there's pain, there's dryness, or there's some other issues as a result of menopause, the same thing is commonly happening to the bladder at the same time. So frequently we'll see patients who will both complain of pain issues as well as issues with the bladder, burning, discomfort, frequency, urgency, and stress incontinence. The Mona Lisa can actually cure both. So it helps not only the dry issues, the pain issues that patients are having, but it actually causes the bladder tissue to become healthy again.
Wow. And I think the bottom line is there are options other than surgery, and it's really something to not be embarrassed to talk about, to have those conversations about, to make sure that you can go to your doctor and have an open conversation and get some relief. There's no reason to live with it.
There's actually both of these treatments, the Mona Lisa Touch, as well as this treatment that if patients did a simple treatment regularly, starting with their first child, it would reduce incontinence by probably somewhere around as much as 50% is what the statistics show.
Dr. Lisa, well, thank you so much for this information. You can mention Twin Cities Live when booking your appointment with Dr. Lisa and save $100 on your Mona Lisa Touch treatments. You're going to need to book that appointment before the end of May. Big thanks to Wyzetta Cosmetic Surgery and Spa for sponsoring the show, and Dr. Lisa for always telling it like it is. All right, coming up next.